Hello, you're right. How can I help you? You have an appointment with us? What time is your appointment? And you are? Okay. Yes, I can see you. Lovely. Have you been to Dr. Light before? You haven't? Okay, so you're a new patient. Lovely. So just to make you aware, she is running a little late today, I'm afraid. My apologies. She was on holiday last week, so we're playing catch up a little bit this week. Okay. And what was your appointment for today? An ear cleaning, okay. Lovely. And are we doing a hearing test for you as well? Okay, that's fine. So I can see here that you were referred by your doctor. Okay. So I'll just give you a new patient form to fill in if that's okay. Just the usual details, name, date of birth, address, that sort of thing. Alright? And you're very welcome to just help yourself do tea or coffee or water whilst you do that. Okay? And can I just double check with you that you've had no signs of fever or any colds or flu in the last 7 days? You're fine? Okay, lovely. Wonderful. Okay, so if I just give you the form to fill in, this is the new patient form. There we go, lovely. You got that? Okay, lovely. So if you just fill that in for me, and then I'll add your details to our system. Okay? Just make yourself comfortable. Hello, Dr. Light's office. Yes, speaking. Hello there. I'm afraid we're fully booked for the next couple of weeks. The next appointment that I have available is in August. I can do the 4th of August. Yeah. What time would you like? I have 11:30 in the morning, 3:30 in the afternoon. That's perfect, 11:30. Lovely. And may I ask what it is in regarding? Okay. That's no problem. Perfect, so that's all booked in for you. We've got you here on the system. So we'll see you on the 4th of August at 11:30 in the morning. Lovely, thank you. Bye-bye. Hello, Dr. Light's office. Yes. Hello, Doctor. Yes. Of course. I can send those through to you now. May I have the last name, please? Okay, that's perfect. I'll send those through to you now. Lovely. Thank you. Hello, you got that form for me? Oh, lovely. Thanks very much. I'll take that from you. No problem. Perfect. Okay, so let's just have a little look. Okay, lovely. I've got all your things here, your details. Let me just add them to my system. Okay. You're very welcome to just sit down in reception if you like. Just relax. She shouldn't be too much longer, no. And can I just double check with you with regards to any allergies? Okay. That's fine, no problem. Hello, reception? Yes, doctor, hello. Marvellous. All right. Thank you, I'll send them in. Okay. Okay, so Dr. Light is ready for you. You can just go through the door on the left and she'll be waiting for you in the rooms. Okay? Lovely. Hello there. Do come in. I'm Dr. Light. It's lovely to meet you. I'm so sorry about the wait. I do apologize. You weren't waiting for too long, were you? Okay, good. So I'm just going to put my gloves on and tell me a little bit about why you're here today. Okay. And have you had your ears cleaned before? Okay. Well, there's nothing to worry about. There's no pain or discomfort. And obviously if there is, then you just let me know, okay? But there shouldn't be any discomfort at all. I'll do a thorough check and make sure that there's no infection, okay? And I'll also do a brief hearing check afterwards just to make sure that you're hearing in the full spectrum, okay? Lovely. Alright, so let's get started. I'm going to begin first with an exam inside your ears, okay? I'm going to use this little tool called an otoscope. I wonder if you've seen one before. Okay. Right, just get myself sorted here. So let's start on this side, okay? So I'm just going to take a little look inside your ear, if that's all right. Okay. Okay. How was that? Okay? Not too uncomfortable? That's good. Alright. So let's have a look at the other side, okay? Alright. So I'm just going to come around the other side and just have a little look here inside the ear. Alright, doing very well. Alright. Lovely. So I'm just going to feel behind your ears, okay? Just doing a quick exam, making sure that there's no lumps or bumps or anything behind there. So have you been having some trouble with your ears lately? Mm-hmm. Any tenderness in this area at all? Okay, good. And have you noticed recently any pain or discomfort radiating to your jaw, down your neck? Okay, any headaches? Any sinus issues? Okay. Alright, good. Okay. So that's fine. That all looks and feels fine. Okay. So with the ear cleaning, what I'm going to do is I'm going to apply a very gentle cleaning solution to the ear one at a time. Alright. So it might feel a little ticklish, but it won't sting in any way. Alright. And so once I've applied the solution in both ears, I'll just give your ears a little massage, alright? Just to allow the solution to do its work. And then afterwards I'll go in with my little ear cleaning tools and very gently and softly clean your ears for you, alright? You're very welcome to close your eyes if you like. It can be quite relaxing sometimes. So the cleaning solution is a mild saline solution. It's one that we use regularly here in the clinic. So I'm going to start on this side, okay? I'm going to just do a couple of drops. And one more. So, I'm just going to hold this little bit of cotton wool to your ear for just a moment, just to dab away any excess solution. We don't want it getting on your clothes. Alright, there we go. How does that feel, alright? Not uncomfortable in any way? I feel a little bit strange, yes. That's quite normal. Alright, so let's do the other side. Okay. And just one more here. And as we did last time, I'm just going to very gently place a little cotton wool just here on the side, just to collect any extra solution. Okay. All right. So, whilst the solution is in your ears, I'm just going to ever so gently massage around the ears for you, okay? So I'll be extra gentle, and if at any point it feels uncomfortable, you just let me know, okay? Alright. So the reason that we do this gentle massage is it just helps the solution to do its work. It helps to loosen any debris or any wax buildup. Makes our job easier. So it also helps to relax the muscles around the ear and of course relax the muscles around the jaw as well. All of the muscles in the face and the head are all connected, and the ears are remarkably sensitive, so we're always very careful and very gentle. Alright. Okay. There we go. Good. So the first thing I'm going to do is I'm going to go in with my little fluffy pick, alright? And it may be a little ticklish, but that will just help to swipe away any debris, any dust, any wax buildup that may have come loose from the ear massage, okay? So let's start on this side. So just a little fluffy. Okay, good. And now the other side. So just once again, little fluffy ear pick. Can actually feel quite pleasant. It's very soft, very gentle. And this is usually the part that most of my patients enjoy the most. Okay. Alright. Okay. Right, so the next phase of the cleaning is I'm going to use these little metal tools, okay? And I'm just going to ever so gently scrape any excess earwax from the ears, okay? I'll also be using my otoscope just to check inside the ear canal and just to make sure that I'm getting everything that I need to, alright? Good. Alright, so starting on this side. Okay, so just having a little look. Okay, take another look quickly. Alright, good. Let's do the other side. So let's take a look inside. Ah, yes, okay. Perfect. Right, so just a little scrape, okay? Okay. Take another little look inside. Let's just see. Okay, that's much better. Much better already. So I'm just going to wipe your ears here very gently. Just again to make sure that we've got any excess. Okay. Good. And this side. Lovely. Okay. So, how's that feeling now? Good. Comfortable? Marvelous. Okay. So I'm going to do a quick hearing check, okay? Just to make sure that everything is working as it should be. So I noticed from your notes that you haven't had any complaints about your hearing before. So have you noticed any changes recently? Have you been finding any particular sounds more difficult to hear? Higher sounds? And have you noticed any change in your hearing in crowds or in busy situations when there's lots of people or ambient noise? Have you been struggling at all to hear? Okay, all right. Okay, good. So I'm going to do a quick check using a tuning fork. Okay, so this tuning fork is quite a high frequency. It's 528 hertz. So it's quite a pleasant, high-pitched sound. And the reason I'm testing this one for you is usually it's the high-pitched sounds that we tend to lose access to first. Okay? Yes. So if you'd like to close your eyes for me, and I just want you to point as to where you hear the sound coming from, okay? Whether it's from this side or this side, or behind you or in front of you, okay? Lovely. So close your eyes for me. There we are. Excellent. Well done. Okay, let's do another one. Very good. Well done. That was a bit soft, that one, wasn't it? Alright, let's do this one. Perfect. Very good. Well done. And what about now? Very good. Well done. Okay, so you did that very well. I'd like you to keep your eyes closed for me, and I'm just going to move the tuning fork around you, okay? And I want you to tell me if the sound is the same or if it's different, alright, on either side. Okay? So. Now, is that about the same, or did you notice a marked difference in the levels of sound, levels of volume? About the same. Alright, lovely. Perfect. Okay. Okay, so the next hearing test that I'm going to do is a whispered comprehension test. Okay? So I'm going to be whispering numbers in each ear one by one, and all I want you to do is repeat what you hear back to me. Okay? So just for an added level of interest, I'm going to be whispering through this cardboard tube. Okay? So this may add a subtle level of distortion to the sound, and I'm really wanting to test your ability to hear a soft whisper with slight distortion, okay? Alright, so very good, well done. Let's do another one. 96. Very good. Okay. So next I'm going to whisper a short, simple sentence, okay, to you, and I will ask you a question about the content of the sentence, or I will ask you to repeat the sentence back to me. Okay, so this is a simple comprehension test to make sure that you are hearing correctly and also interpreting the information that you are picking up through your ears. Okay? Don't worry, you'll do fine, I promise. Alright. Let's do the first one. The cow jumped over the moon. Could you repeat that back to me, please? Very good, well done. Let's do one more. Rainy days are perfect for tea and naps. That one was a bit longer. So I'm going to ask you a question about that. What type of days are perfect for tea and naps? Well done. Excellent, well done. So that concludes your hearing test. I'm very, very happy with your results. Well done. Yes, no concerns at all. So I'm going to write up your notes for you, okay? I'll send those through to your GP so that they've got them for their records and for your records as well. And I'll see you again in another month or so for another checkup. If you'd like, you can just book in with reception. Wonderful. Well, thank you so much for coming in. It was lovely to meet you. Such a pleasure. Do take good care of yourself now, okay? I'll see you again soon.